Hi everyone, I'm Dr. Hootan Zandifar, a double board certified facial plastic and reconstructive surgeon and a hair transplant specialist. I wanted to take a few minutes to go over the history of hair transplantation with you and talk about some of the advances that we have and what the future looks like. Mid to late 20th century, hair transplantation was still something that was evolving. Techniques to restore balding spots included various surgeries where you take pieces of hair-bearing scalp and you rotate it to cover the bald spots, or you do what was called macrografting. You take big patches of hair and implant it in balding spots. As you can imagine, even though it did give hair coverage to areas that didn't have hair, it didn't look natural. The rotation flaps left big scars in place, and the direction of hair growth wasn't normal or natural. There was no hair part, and many other kind of challenges. The big macrographs, or the big patches of hair-bearing skin that were implanted, give you that telltale sign of hair plugs, where it kind of looked like palm trees that are coming out of the scalp. It looked very unnatural and not cosmetically something that was desirable. As techniques advanced, as our science about hair anatomy and physiology advanced, we realized that we could make those grafts smaller and smaller and smaller. They became micrografts, so they were smaller, they weren't as big of a patch, and people would kind of implant them in a row close to each other to give more of a fuller hair. They still looked a little bit unnatural, though they looked better than before. Now finally, we were able to understand the follicular unit of hair. Now, a follicular unit is a patch of hair that's grouped together, and it could have 1, 2, 3, 4, maybe 5 hair follicles coming out of it. But they're just grouped together, they grow together, and this follicular unit can then be implanted. This technique was called Follicular Unit Transplantation, or FUT for short. With follicular unit transplantation, we were able to take these small follicular units and transplant them over the balding area. And as we improved our technique of transplantation and we kind of improved how we could put the hairs in the hairline, we were able to give a very natural looking hairline and full head of hair that looked and behaved exactly as normal hair in that area did. This was cosmetically beautiful and natural. No one would know that there was any hair transplantation that was done. This hair could be cut, could be colored, could be styled the way that you normally would style the hair in that area. The only challenge that the follicular unit transplantation at that time had was that in order to get those hairs, we'd have to take a big strip of skin from back of the scalp. And then when you suture that, there was a visible scar back there, so you could never wear your hair short. This was the strip technique. Now, as the century came to an end, there was increasing advancements in what is called follicular unit extraction, where we would use a device such as the device we have here to individually extract these little hair follicles from back of the scalp and side of the scalp, where the hair follicles are immune to the effects of balding. These hair follicles were individually being plucked, and then we would take them and then we would transplant them in the areas that needed them. This was called the follicular unit extraction technique, or the FUT. The beauty of the FUT was that you get these hairs out the same as you would with the strip technique, but then you no longer had that telltale strip scar. So it's almost like a no visible scar technique. You could shave your head and no one would know that you had a hair transplantation. You could style your hair however way you wanted to. With the advent of follicular unit extraction and follicular unit transplantation, hair transplantation went from hair plugs and visible scars and really not good looking hair transplantation to something that today no one will know that you've had anything done. Now recently there's been more advances with robotic and augmented reality that has allowed us to improve our techniques and our results even more. So this has been a short, brief history of how hair transplantation has evolved over the past century. Now, if you have any further questions, you can call our office, come and see us, message us on social media, and just allow us to be a resource of information for you regarding hair transplantation. Thank you, and we'll see you soon.